Do you have a specialty in mind that you always wanted to specialize in since your medical school? Or perhaps you have grown interest in it in recent times and you want to know more about it in detail. To help you with this, we have started this Your Specialty of Interest series where we have already covered a few specialties where we discussed the structure of the UK training pathway, different subspecializations in that specialty, competitiveness to get into that specialty, pay in that specialty, and more importantly, how an IMG can get into the specialty training in the UK. In today's installment, we're discussing about trauma and orthopedic surgery.
If this is the first time you're checking out our channel, welcome. Basically what we do is we run a website that's totally free known as roadtok.com, and it will explain the ins and outs about everything related to the United Kingdom and what it takes for you to work as a doctor in the NHS. So if you've not already, please stalk us on all of our social media. Find us on Facebook, find us on Twitter, Instagram, and of course, YouTube. Don't forget to subscribe.
We have an exciting announcement. If you don't know already, RoadToUK is starting UK-wide IMG mentorship program in order to help new starter IMGs to find a footing in the NHS. We're planning to match mentors or mentees every 4 weeks. And you may be asking, what's in it for them? Obviously, the mentees will get benefited from the insight and experience of an already landed NHS doctor who will be the mentors, and the mentors will receive a certificate based on the feedback from the mentees. The whole process will run on voluntary basis completely for free. If you're interested or know someone who will be interested in joining this IMG mentorship program, please apply today at road2.uk/mentor or mentor.road2uk.com. So let's get started with specialty training and career in trauma and orthopedic surgery in the United Kingdom. So the first question, what does it have? What are the other subspecialties that are included in trauma and orthopedic surgery? So in the curriculum, it says there's 8 main general areas of this specialty, and obviously 6 of them are anatomical areas and 2 of them are non-anatomical. So what are those areas? So 6 anatomical areas are hand and wrist, shoulder and elbow, spine, hip, knee, and foot and ankle. When I was making this video, I found that in any way or form, dancing skeleton are always funny. Okay, let's get back to the business. The other 2 non-anatomical areas are pediatric and major trauma. So there are total 8 types or 8 different branches of this specialty, which generally is termed as special interest. This entire video is made from the new trauma and orthopedic curriculum that has been published in August 2021. So if you're watching this video in a much later date, I would suggest please go to GMC website and see what is the latest trauma and orthopedics curriculum is. So this is the structure of trauma and orthopedic surgery specialty training pathway for a UK medical graduate. So these things can differ for international medical graduate. Just to explain, so after graduation you do foundation training, then you join core training or run through training. If you join core training, then you have to go through again a national selection process to get into the specialty training for trauma and orthopedic surgery. And you see there is MRCS in between core and specialty training, and there is FRCS exam to pass while you are a specialty trainee. So how can it be different for international medical graduate? The thing is, an international medical graduate, if they want, they can take exactly the same pathway as it is, because if they obtain GMC registration right after their medical graduation, they can join foundation training, they can then join core training or run through training and special training. So it could be exactly the same. They just have to take that extra step of getting GMC registration by whatever way they can, but they should be eligible to join the foundation training in the UK. But if they are not to join foundation training in the UK, there is another pathway which is called obtaining the CREST form. So they can get this by way of doing some non-training or trust gate jobs, which is equivalent of the foundation training. Or if they're overqualified to join core training, which we will discuss later in this video, they can actually get an alternative core competency certificate, which is equivalent to core training, and then join specialty training directly without going through core training. So there are many deviances from the bare bone structure of pathway for IMGs that can get into the specialty training. But if you're confused about whether to join foundation training or whether you can join foundation training or you want to take the pathway to obtain CREST, please watch this video where Dr. Ibrahim has discussed this whole process in detail, explaining what is the best first job for your case after you obtain GMC registration. Let's talk about core training for trauma and orthopedic surgery. So even though I put these two together in the same slide, but they are a bit different from each other. So if you join core surgical training, you will have to join a separate national selection process to get into an ST3, which is the higher trauma and orthopedic surgery, the specialization in trauma and orthopedic surgery. But if you can join an improving surgical training, which has started piloting in 2020 for trauma and orthopedic, your progression does not involve a national selection process. So it only depends what your outcome is at the end of your second year of improving surgical training. So this is kind of a run-through training where the program becomes a one stretch. But for core surgical training, it's not run through, it's uncoupled. So you do 2 years and the rest of it later on after a national selection process. So what happens in these 2 years of core level training? So the one thing you have to get done is MRCS, and the progression would be assessed by different workplace-based assessment. We'll get to know after a few slides that you can be overqualified to join this training. So what happens when you are overqualified to join this training? So there is one separate form which is called alternative core competency form, or it's also called certificate of readiness to enter higher surgical training. You have to get that form signed by the authorized signatory to allow you to join a higher surgical training if you cannot join core level training for surgery. So you have to keep that in mind. And we'll discuss about the overqualification criteria right now. So what are the restrictions to join core surgical training? I think a lot of IMGs can get caught up into this. This is the criteria of career progression in core surgical training's entry criteria. So it clearly says you have to have 18 months or less experience in surgery, and this experience will be in any full-time equivalent job, and all experience in this post at any level specialty. So it could be any surgery, not necessarily general trauma or anything. It could be any surgical specialty you have experience in, and irrespective of the country, you do have the experience. So if you have an accumulative of 18 months or more, so more than 18 months experience, you will be deemed overqualified to join core surgical training. So let me explain this a bit more detail. Say you are a registered doctor, so it does not matter where are you registered. So you are a registered doctor in any country and you have accumulated 18 months of surgical experience, and until when? By the time you apply for core surgical training. So by the time you're applying for core surgical training, if you have accumulated 18 months of surgical experience, it's fine. Or after being registered, you have accumulated less than 18 months of surgical experience by the time of application, this is also fine. But if you have more than 18 months of surgical experience and you're applying for CST, you will be deemed overqualified. I hope that makes sense. Now let's look at the specialty training a bit more detail. So obviously the phase 1 of the whole program is the core training, which can be core surgical training. And then after the core surgical training is done, you have to apply and you'll go through an interview, a national selection process. Or if you are in improving surgical training, you don't have to go through this interview. You'll have to apply, but the process would be determined by your progression in improving surgical training rather than going through a national selection process. And phase 2 comprises of 4 years of trauma and orthopedic training. During that 4 years, there will be different modules and different branches of trauma and orthopedic surgery that you will rotate to. And next comes the phase 3, which is probably better termed as the fellowship period where where a trainee develops some special interest in specific areas of trauma and orthopedic surgery, which is indicative of 2 years. So obviously during this whole period, your progression is assessed by different workplace-based assessment. And after this 4 years of initial training, you'd be eligible to sit for the Intercollegiate Specialty Board, which is the FRCS for trauma and orthopedics. And after you pass the FRCS exam, you can then join this last 2 years of fellowship. And then after you complete it, you will obtain certificate of completion of training and will be recognized as a specialist in the UK under GMC and can take consultant posts. So the modular structure actually allows for doctors to be a bit more flexible about what they get trained in, and also makes them more employable in future when they become a consultant. So obviously in these 4 years as an orthopedic surgeon, orthopedic trainee, and orthopedic registrar, you will be in touch with general trauma, and at the same time you will rotate through all the different other branches that we have talked about in the first few slides, where there's hand and wrist, shoulder and elbow, spine, hip, knee, foot and ankle, pediatric, ortho, or major trauma. Those are the different branches that you will rotate to. So it could be 6 months each, or it could be a 1 year combining the two together. So it's like all depends on how or which region you got into training, and the discussions with your training program director, how it is all separated, depending on the necessity of the area that you will be working or getting trained in. So the next part is 2 years, which is a bit, as I said, looks as a fellowship. People during their 4 years of orthopedic initial training, they plan about this fellowship, like which consultant they will be doing under, where they will do it, what kind of specialty or what kind of special interest they want to grow when they themselves become a specialist. So obviously the main background learning is general trauma, to manage an unselected trauma case is there, along with one or two of the following things. So you see, it's quite interesting in a way that a person can become a trauma and orthopedic consultant surgeon with special interest in upper limb. That means they actually did their 2 modules in hand and wrist and shoulder and elbow. Or a trauma and orthopedic surgeon with special interest in hip and joint reconstruction, where they have probably taken hip and knee. So it could be a mix and match of a different special interest modules, and they become the surgeon of that special interest. Obviously in special cases, by discussing with your training program director, you can develop special interest in these cases like tumor management or specialized peripheral nerve repair. But as I said, it involves discussion with your training program director way ahead of time, and obviously the opportunity of those specializations in the area that you will be training in. Now the burning question: how competitive it is to join core surgical training. So I'm going to give you these numbers of applications and posts, but you have to bear in mind that applications doesn't mean that the trainees or the applicants only applied in core surgical training. They may have applied in improved surgical training, which is separate application. They may have applied in anesthetics. They may have applied in medicine. I mean, that's unlikely, but they can, GP. So applications does not mean that all of the people that applied are very, very committed to this specialty. But obviously, the more competitive the specialty is, people tend to develop their portfolio to the point so that their application gets accepted and they get called for an interview and they get the post. So to look back in 2018, the applications for core surgical training was 1,870 for a post of 636, giving a competition ratio of 2.94. So just to simplify this, that means for one post, almost 3 people applied. So in 2019, this was the application and this was the post, and almost the same amount of competition ratio. In 2020, massive number of people applied, but not many posts, giving a bit more competitive picture of the specialty training. And how competitive is trauma and orthopedics? Trauma and orthopedics is fairly competitive, I would say. In 2018, applications were 409 for posts for 142. This figure is for the entire United Kingdom. So entire United Kingdom, comprising of England, Wales, Northern Ireland and Scotland, they had 142 training seats in 2018. They're giving a competition ratio of 2.66. In 2019, 519 people applied and they had 167 posts. So post number a bit increased, giving for one post more than 3 people applied. And in 2020, even massive number of people applied, but there was less number of training seats throughout the UK, giving rise of a massive competitive ratio. So for one post, more than 5 people was applying. Another question, how much is the pay of a trainee or even a consultant? So the pay that I've shown here is for the NHS and it's the basic pay. It does not include any on-call or weekend or anything of that sort, which may increase the salary to a greater degree depending on how frequently you are doing on-calls and how frequently you are doing weekends, how busy of a hospital is, how much less staffed your hospital is, and how frequently you have to do it. So it's really difficult to say how the variable would be, but we all know what the basic would be, which would be equivalent of working 40 hours a week, 9 to 5, Monday to Friday. So for ST3 to ST5, the basic salary of a trainee is £50,017 per year. And when you become an ST6 to ST8, your basic salary will become £53,077. And after you get your CCT and you join a consultant post, the starting salary of a consultant, basic salary is £82,096. Again, I want to reiterate, this is the salary in NHS and also the basic salary. As a consultant orthopedic surgeons, you will have scopes to do private work, and how much that will add to your income is beyond a speculation because it's so variable geographically and what kind of special interest you have developed, how niche is your specialty. So it's quite impossible to give you an exact figure how much a consultant orthopedic surgeon will earn from their private work. But obviously there are chances of doing private work in the UK when you are a consultant orthopedic surgeon. Now let's tie all the loose ends and discuss in detail about what is the surgical training pathway for in trauma and orthopedic surgery specialty for IMGs. So obviously IMG, they became a medical graduate, and the step would be to obtain full GMC registration. So if they get provisional GMC registration, then the pathway is exactly the same as I described before for UK graduates. So if they can get provisional registration, they have to join foundation training, then core training, or run-through training, then specialty training, and that's that. But if you've already obtained full GMC registration and you cannot join foundation training in the UK, obviously the next plan of action would be to join a non-training job, where you will focus on getting your CREST form signed so that you can later apply for the core level training or improving surgical training. Remember, this is a thing to remember about overqualification. So whatever non-training job you're doing, if it's surgical, you have to keep an eye out to become overqualified to apply for CST. So after you join CST, you complete MRCS, and then you join trauma and orthopedic surgical training. The other pathway is, if you already obtain MRCS before even coming to the UK and you obtained full GMC registration by that pathway, you can still, or you should still, join a non-training job. It could be a clinical fellow, it could be a trust gate doctor, it could be a registrar level job, it could be a junior level job, depending upon what you feel comfortable with. And then while doing this non-training job, you can work towards getting your CREST form signed and then apply for CST. Obviously keeping in mind that you are not going over the overqualification. If you do go over the overqualification, you cannot join CST, that the only pathway left for you to progress is to work towards getting an alternative core competency certificate signed, which will enable you to apply for trauma and orthopedic surgery. I hope that makes sense. If you are confused about what is the difference between a training and a non-training job in the UK, please watch this video in your YouTube where I have discussed about the different aspects and where can you apply, when can you apply for training and non-training job, and the fundamental difference between applying for training and non-training jobs in the UK. So there is another route to complete this whole program, which is called CESR route. So CESR stands for Certificate of Eligibility of Specialist Registration. So these are for the people who doesn't want to join or who can't join, or maybe they have already have years and years of experience, have completed FRCS orthopedics outside UK and been working as a consultant trauma and orthopedic surgeon outside UK for a long time, and they want to move to UK and become a specialist here. So they don't have to go through the entire training program of trauma and orthopedics if they can prove that all their work and training abroad is equivalent to the training in the UK. So there's a lot of things involved, and the application is actually goes to this training board first, which is the surgical training, and obviously you have to submit evidences supporting your claim, which will involve getting obviously your FRCS exam done, and also your skills and experience of working in this specialty, along with your portfolio, which you can get it for free for elogbook.org, and then papers and presentations, courses, relevant courses that you have to obtain or the trainees have to obtain. You have to do that on your own accord, and also audits and structured references from other colleagues. So the process of this would be mainly to join as a senior fellow or a senior registrar in the UK and use that work experience to collect all these evidences together and then apply for CESR. This is a very not time directed pathway, like it doesn't have a time limit to it. How long can you take to apply for CESR? You can take 5 years, 6 years, 10 years, 15 years. It completely depends upon you and how you have gathered all the evidences to support your CESR application. Obviously, the trainees are in a time directed program where they finish and progress, and obviously they have more support from the deaneries and all the other things. There you go. We have reached to a conclusion of our today's trauma and orthopedic surgery specialty training pathway, and specifically how an IMG can join in this specialty. If you have any questions related to this specialty training pathway, please ask in the comments below. We're always happy to answer. If you have not subscribed already, please subscribe to our YouTube channel and follow us on Facebook, Twitter, and Instagram. Have a nice day. Thank you.